Hello there, it's me, John Miller, the osteopath. I'm here again to continue with my theme of lower back decompressive techniques that you can try yourself at home. In my last video, I demonstrated the foraminal gapping decompression technique where you're lying on your side with a pillow under your waist, arm over the edge and leg straight out to decompress the lumbar spine through here. We're going to make this a little bit more dynamic now. I'm going to bring the knee back up, if comfortable, and we're going to discard this pillow for a bit. We don't need this, because what we want to try to do now is actually switch on the muscles of your stomach. I want you to think about sucking your belly button towards your back, and if you can, even creating a little bit of space under here by sucking in the muscles here. They're your oblique muscles. But I only want you to feel everything sucked in the front and not in the back. We want to take the pressure away from the back. Now in Pilates, there's a technique called arm openings. You bring your arms forward, up in the air and rolling round. And this is a really nice technique. And you should do it as you breathe out, and as you come back to the middle, you breathe in. Making sure to keep your tummy braced the whole time. It's a lovely technique, but of course a lot of people don't have the mobility in their shoulders to do this. So what I suggest is what I call the archer technique, is if you're pulling a bow. So imagine you're pulling a bow back towards you, then the arm goes here and then letting the body roll with it. Keep the tummy held in the whole time, so keep this sucked in here and in here if you can, and then coming back to the center. So we're putting rotation through your spine like that without any strain on the shoulder joint. Obviously eventually we do want to be able to introduce more movement through the shoulder like this, but this is a good start for anyone who's got a back issue and a shoulder problem that prevents them from putting adequate rotation through the spine when they're laying on their side. Now, the next exercise I want to give is remaining in this position, and we're going to start to use the legs. As before, keep the tummy held in, both in the front and on the side here that's laying on the surface of your bed or on the floor or the table, wherever you are. Now, as you can see, my knees are bent at 90 degrees. What you're going to do with this is letting the legs slide out and back, as we did in our foraminal gapping technique. The difference being that now your tummy is tucked in. And you start initially by retaining contact with the table the whole time, so as not to put undue pressure on your spine. You can breathe out as you stretch out, breathe in as you come back. Breathe out as you stretch out, breathe in as you come back. A more advanced version of this is to actually lift the leg off the ground. So now there's a space between my knees. Bring the knee up towards you, and now kick it back. Bring it up towards you, and now kick it back. Making sure, of course, when you do this, your pelvis is not moving. Sometimes as you bring the leg up, you can bring it up too far and you start to round your pelvis. As you can see, the position of my back, now I'm putting too much movement through my back. So you want to bring the knees at most to 90 degrees and straight out again, so the leg is straight and not back too far, because as you can see from my tummy, as I do this, I'm now bending my spine again. This has to be rigid the whole time. So knee to 90 degrees and straight, and let it hover over the top. As you do this, of course, keep breathing out as you bring the leg out, and breathe in as you bring the leg up. You'll start to feel a bit of a burn on the side of the hip here, particularly the tensor fasciae lata muscle, and to some extent also the gluteus medius and the maximus as you're kicking back. I don't expect you to do many repetitions. Do as many reps as you can comfortably with good form. And then rest. If it's easier, once your form breaks, you can then resume the original exercise we do, where the leg is maintaining contact with your own leg and with the bed, and you can continue. And if you wish, you can then bring that back into the archer rotations as well. as a nice gentle sequence. Of course, the whole time, don't forget, your tummy has to be held in, because this is a core exercise. Your core governs the range of motion. And remember, of course, to breathe out as you reach out, and breathe in as you come back to the center position. So breathe out as you roll, and breathe in as you come back to the center. Like so, with the upper extremity. With the legs, as I said, it's different. You breathe out as the legs come out, and you breathe in as you come back up. So breathe out as the legs go out, and breathe in as you bring the legs back up. And as before, keep the tummy held in the whole time. So as you can see, there's lots of different progressions of this particular exercise. And only do these slowly and gradually as within your capabilities. But please do attempt the more difficult variations, and that way you'll be able to challenge your body more effectively. I hope you enjoyed this particular group of exercises. As I said, they aren't particularly strenuous, but it's more about technique and form and pain relief than anything else. Okay, so if you're looking for something a bit more advanced, I have other videos in my repertoire, and if you look back historically, you can find those as well. Anyway, like and subscribe, and I hope to see you in the next video. Take care. Goodbye.